I'm Dr. Manasa Kakunje, a consultant in Pediatric Hematology, Oncology and BMT. The word cancer usually brings to our mind an adult, but unfortunately 50,000 to 80,000 of children get diagnosed with this condition every year in our country. So these children, they can come with cancers like blood cancers or brain tumor or cancer in other parts of the body like Wilms tumor, neuroblastoma or bone tumors or other types of cancer which are very common in children. So the difference in cancer in adult and children is that most of the childhood cancers are treatable, especially if they are treated and diagnosed and treated early. Most of the children, they need a comprehensive care when they are being treated. So we at Bagchi have a 50-bedded pediatric oncology unit being led by pediatric hemato-oncologists. We also have pediatric intensivists, then pediatric nurses, then radiation oncologists and blood bank services all under one roof at our center. So taking care of pediatric oncology cases, it needs a comprehensive care during the treatment as these children are in their growing stages of life. So unlike adults, like most of the time when we say chemotherapy, we have the fear they will have side effects, they'll have loss of hair, loss of appetite, vomiting, many of the side effects. So we get scared how our children will be able to tolerate these. So, but the good thing about children is they tolerate chemotherapy better with lesser, they tolerate the side effects better and they have lesser side effects. And the fortunate thing about pediatric cancer is that many of the pediatric cancers are curable unlike adult cancer. So they need to be diagnosed and treated early and they need the comprehensive care for best outcomes. Some of these children with cancer also need bone marrow transplant as a part of their treatment when they do not respond to the initial chemotherapy like thalassemia or aplastic anemia or immunodeficiency disorders. They also need bone marrow transplant which can be curative for them. The treatment for pediatric cancer can last long duration, is usually of long duration like almost many of the cancers like blood cancers, leukemia, which is the most common hematological malignancy. The duration of treatment can last up to 3 years, and many of the other pediatric cancer also the duration of treatment can last long like 1 year. With initial part of the treatment up to 6 months of therapy can be very intense. We hope to give comprehensive cancer care to the child who needs it by early diagnosis, early referral and proper and comprehensive pediatric cancer care at our institute.